right, and as we see a new leading variant in COVID cases, CDC numbers showing only 34% of eligible people, though, have the most up-to-date booster.
Madison Kimbrough spoke with a doctor who specializes in vaccines along with people on the Strip about their thoughts on the most recent booster and if they feel it's necessary.
I've had COVID twice, and my nose got stuffy and it was gone after like a week. I've not been boosted. I don't think it's necessary.
Whether it's the common cold, the flu, or COVID, 'tis the season for getting sick. And while many out there are dealing with some sort of illness, many have decided not to get additional vaccines to protect themselves. According to the CDC, 63% of residents living in the Las Vegas area are fully vaccinated, while only 26% are boosted. Since 2021, there have been 3 boosters released. Dr. Jonathan Bakhtari, CEO of E7 Health, says he has his own theories on why the boosters are less popular.
You already took, 2-3 vaccines, you got COVID. It's hard to convince someone to then go get a booster, especially a booster that doesn't cover the current strains.
The CDC says 80% of the population is partially vaccinated within the U.S., with 68% being fully vaccinated. Mark Jones sharing with 8 News Now that the only reason he got vaccinated was because it was mandatory for work. Jones doesn't think a booster will keep him from getting COVID in the future.
I didn't mind getting the first initial. I had to for work anyways to keep my job, but after that and looking around at all the people that continue to get it that still have and that keep passing away that even have the boosters, ain't no sense of getting no more.
That was Madison Kimbrough reporting. More data on the new XBB.1.5. Latest estimates from the CDC show it is now the leading variant in these new COVID cases, nearly doubling its percentage share of all cases. That's across the country. The week heading into Christmas, it was at 21%. Projections for this past week are up to 40%. Though hospitalizations are up just slightly, experts don't believe this variant carries a greater danger really than any others, and the same prevention measures are encouraged.